Hello, everybody. My name is Sarah. This is a video about high blood pressure management, and this is for ECPI University for class nursing 443, taught by Julie Townsend, and it's called Community Health. So let's get to it. Okay, so here we have a slideshow that I made. It's basically getting a grip on high blood pressure and Shadowville for nursing 443 community health, taught by Julie Townsend. And so this right here is a quick video. We actually only need to watch the first. It's a quick video. It's only 2 minutes, and it's about symptoms of high blood pressure.
Hi, I'm Jessica, and welcome to Medical Minute with Norton Healthcare. If you're wondering what some early signs of high blood pressure may feel like, know first that the number one symptom of high blood pressure is often no symptoms at all. High blood pressure or hypertension is called the silent killer because many people do not feel any different unless it becomes severe. Some symptoms may include facial flushing, red spots in the eyes, or dizziness. But the only true way to know if you have high blood pressure is to get it checked at least once a year. If left untreated, high blood pressure can lead to stroke, heart attack, kidney failure, and other serious and even deadly conditions. Normal blood pressure is considered 120 over 8. If you've had a normal blood pressure for the most of your life, things that can raise it include age, change in diet or alcohol intake, having a baby, and certain birth control and medication. This is why it's important to check your blood pressure early and often. Schedule an annual checkup with a provider at nortonhealthcare.com/primary care or by calling 502-629-1234.
Okay, so that was a quick video right there, but we do have some important facts that was on that video that I want you guys to take note of. So that is going to be on
Hi, I'm
the next screen. All right. So the top points that I want you to take away from that is that symptoms of high blood pressure include A, nothing at all, which is why it's called the silent killer. And then you got dizziness, and then you got red spots in your eyes, and then you have facial flushing. So you look like you just got real pale all of a sudden. Some health factors that's associated, meaning some things that happen or that you do in your lifestyle that could be modified or can't be modified, which are factors that can give you high blood pressure, includes having a baby. Sorry, ladies. Alcohol intake, right? So we want to limit that. And then we also have a diet high in sodium. So the actual amount of sodium that we want to aim for is 15 less than 1500 milligrams a day, so less than 1.5 grams a day. A simple explanation of blood pressure is the force of blood pushing through against artery walls as your heart pumps blood through your body, and that came from the American Heart Association. So basically, like your blood is like a river, and it's just going through your veins, and your blood is trying to make it back to the heart, and then up to the lungs and like to your body. And so when you have high blood pressure, there's a lot of blood, and it's a lot of force with that blood going through. It's not running smooth. It's like a dam in the way or something. All right, so over here you see a picture and it's saying that normal blood pressure, the systolic is 120, the diastolic D for down is 80. And then you have elevated 120 to 120 in systolic. And then you have stage one hypertension, 130 to 139, stage two, 140 to 180. And then you have a hypertensive crisis, which is 180. Please, if you have a hypertensive crisis, meaning 180 over 20, do not take your blood pressure again. You need to call for help. Okay. You need to get to the hospital. Um, Call the ambulance. Whatever is possible in the predicament that you're in at that moment. You're in a crisis. All right. What is heart healthy nutrition? So when you have blood pressure, there's a few things that you can do in your life to help it out. One of the things is a heart healthy diet. Most people go by the DASH eating plan. Okay. So this right here is going to take us to the DASH eating plan, and it's a handout, and the link is also in the comments if you need to see it. Um, a week of eating in the DASH diet, it's basically meats. Red meats are going to be very low, if any, and it's going to be a lot of fruits and vegetables, whole grains, beans, nuts. So basically, like the new food pyramid that we have out here. But anyway, you could take your time to go through this on your own time, but basically, like you could see like an example of a breakfast is like cereal, banana, low fat milk, a slice of whole wheat bread, margarine. Okay, so nope, that's not it. Okay, all right, okay. We gotta go back. All right, here we go. All right, and then over here we have another video. It's called Lower Sodium and Exercise. It's just a little video to tell you about what is high, even though we just went over it, and also like what you can do to help your blood pressure get down. All right, take a look.
I didn't think shingles would make me miss days of work. I was wrong. Talk to your doctor today.
Are you seeing this difference?
Okay, these commercials are not a part of this video. This has nothing to do with high blood pressure.
Up to 50% of heart attacks and strokes are caused by hypertension. So now let's dive into the top 10 ways that you can naturally lower your blood pressure. As you can imagine, diet plays a big role in your blood pressure. And there's one particular diet that's proven to lower your blood pressure by an impressive 5 to 6 points, the DASH diet, which is basically what most people think of as
DASH
diet. Eat more whole foods and lean proteins and eat less salt and processed foods.
dietary approach to stop hypertension.
Is to lower your sodium intake. And I realize that sodium has become a bit of a controversial topic recently, but the scientific evidence is clear. If your blood pressure is high and you want to fix it naturally, you need to lower your sodium intake to a maximum of 2 grams per day. One common mistake I find my patients make when they're trying to focus on increasing their
That is
focusing on
maximum.
the salt
The
sugar.
goal is really 1,500, 1.5 grams. So let's try not to go over 1.5 grams.
Of your salt intake comes from processed foods and eating out. Check out this healthy looking Mediterranean bowl. Honestly, probably something I would order from a restaurant. And that one dish has more sodium in it than you're supposed to eat in the entire day. Let me give you a real world example of how a modest decrease in sodium can have an unbelievable impact. A few decades ago in Finland, they passed laws requiring warning labels on high salt foods and promotional labels on healthy, low sodium, high potassium options. And they made sure food still tasted really good. Even McDonald's was pressured into releasing a low sodium hamburger. Researchers then looked at the impact these policies had on the health of the nation, and the results were astonishing. Over the next few decades, sodium intake dropped by 30%, and the average systolic blood pressure dropped by 10 points. But it gets even better. In the middle-aged population, death rates from heart attack and stroke decreased by 80%, and life expectancy went up by several years for both men and women. But it wasn't just sodium reduction that they focused on. They also promoted foods high in potassium. This is really important because you can almost think of potassium like an antidote to sodium. Where sodium stiffens blood vessels, potassium relaxes them. Not only that, Potassium helps your kidneys get rid of excess sodium by peeing it out. And studies have shown that by increasing the amount of potassium rich foods you eat, like bananas, oranges, sweet potatoes, spinach, and beans, you can lower your blood pressure by as much as 5 to 7 points. But be careful. Loading up on potassium isn't for everyone. If you have kidney problems, or if you take medications that cause you to retain potassium, this is not the strategy for you. So talk to your doctor before you make any drastic changes. Okay, now on to exercise. Up until recently,
Exercise.
cardio was the best way to lower your blood pressure. But emerging research is showing that other types of training may be even more effective. This meta-analysis from the BMJ in 2023 looked at 270 different trials to try to figure out which exercises were most effective at lowering blood pressure naturally. And the clear winner was isometric exercises, things like wall squats or planks, which lowered the systolic blood pressure up to 8 points. Now, if doing planks and waltz it sounds like fun to you, I'm so happy for you. That's awesome. But for the rest of us, keep in mind that this study also proved that any type of exercise you do will help lower your blood pressure. High intensity, low intensity, cardio, strength training, it all makes a difference. So
All right, so there we have it. So basically, exercise, specifically 150 minutes minimum a week, of any type of exercises. Different studies show different things. In this video, it's saying isometric exercises. Some studies say HIIT exercises, so high interval, low interval, high interval, low interval exercises. But as long as you're aiming for 150 minutes of exercise each week, then it will help with that blood pressure problem. And that is what we're trying to get down. Oh, next. All right. So, three things that we want to take away from that is that a healthy diet for high blood pressure is the DASH diet. Um, your ideal sodium intake is less than 1,500 to 2,000 milligrams of sodium daily. And then you want to participate in regular physical activity, at least 150 minutes a week of isometric to HIIT exercise. Right here is a QR code for a flyer that I'm about to show you guys. It just has like a couple tricks on taking your blood pressure. So a couple things I do want to go over is your monitoring frequency. So we got the 2 by 2 by 7 rule, and basically what that means is that you're going to be checking your blood pressure 2 times a day, 1 minute apart. For 7 days. And so this is after you have a reading of a high blood pressure and after you finish taking a new medication or before a physical is coming up. So basically you want to check in the morning before breakfast, before meds, and then 1 minute after that, right? Because you want to make sure that both of these blood pressures are matched and that they're very similar. And then you're going to take it once in the evening before you eat and before any meds, and then 1 minute after that because you just want to compare those two. But you want to take down the average of both of those medications and you want to chart that down. And this is going to be for 7 days. And this is before a visit or a medication change. And then for any emergency action, like I've said before, anything over 180 over 20 a reading that requires immediate attention. Go to the hospital. You need help. All right, and so this is the flyer that I wanted to show you guys. It basically just says, like when you are taking that blood pressure, you don't want no stress or anything. So you want to be sitting down, no caffeine, no smoking, no beverages, no exercise 30 minutes prior. If you're like me and you live on the third floor, that is an exercise. Please don't walk up those stairs and come up here and try to take your blood pressure. You want to sit down and you want to calm down. You want to make sure that you have a good device, that it fits. You want to make sure that your bladder is empty, right? Because that can raise your blood pressure. Um, and then you want to sit quietly without talking for 5 minutes before you take that blood pressure. So I don't know if you guys noticed, but when you go to the blood pressure, if you get a high read and she's like, okay, well, just sit there for 5 minutes. And then usually after those 5 minutes, it usually goes down. Trick or the trade. But this is a handout. You could take your time to look over this a little bit more. And then basically over here to the right, you also see high blood pressure higher than 180 over 20 is a hypertensive crisis. It says wait a few minutes and take your blood pressure again, like if you have that time, but you need to get to the hospital. We're in a crisis. All right. And so now that we just learned all that good information, this is a quick 6-part questionnaire to test your knowledge. Okay. So these are like 6 quick questions. So go ahead and click on the link. That link is also in the comment section for you. And next is just my resources. So that's all I have for you folks. So basically, this is the end of my video, and I just want to make sure that you guys know to do that questionnaire. All right, thank you.